So this is Ida Simmons, first public health matron of Singapore. I'm going to read some excerpts of her talk that she did on radio in 1939. At the end of January 1927, a campaign of health work was started among the kampong folk in the rural areas of Singapore. In the city, infant welfare work had been carried on by the municipal health authorities for some years, but the country people remained isolated. There were fewer roads in those days, the villages even had no names. Judging by Western standards, the infant mortality was appallingly high. Out of every 1,000 babies born, 263.6 died before they were 1 year old. So that's about one third. That was for all races. The rate for Malay babies was nearer 300 per thousand births. Sorry, the one third is for Malay babies. Okay, for the general population, it was about 1 in 4. The stillbirth rate was also disconcerting. Nearly 3 months was spent studying the Malay language and in learning to know my district, which I found comprised the whole of Singapore Island outside the municipal limits, an area of about 200 square miles and a population of about 100,000. These were chiefly squatters, made up of Malays, Tamils, Sikhs, Chinese, Arabs, Eurasians, and some Japanese. After a period of 4 months, work began in earnest. In 2 years and 8 months, I travelled 43,000 miles in and about Singapore. For the first year, the work was practically all carried out in the kampongs or at the roadside. Each district was visited either weekly or fortnightly. Birth reports were collected en route from all the rural police stations, and an endeavour was made to visit each newborn child. In the early days, I was often unsuccessful in tracing all the children whose births had been reported, but always discovered many others whose fathers had not reported birth. The addresses were very vague, the homes scattered in plantations and kampongs, sometimes up steep jungle-covered hills. After a long hot search, one might find that the baby had been given away, or if the mother were a Malay, she and her infant might have returned to some distant kampong, only having come to her parents' home for the birth of a child. Health visiting in the kampongs brought to light numerous cases of postnatal beriberi, particularly among Malays. Many infants and children were found to be suffering from neglected scalds, boils, burns, ulcers, and a variety of skin complaints. There were many of all ages with separating eyes and ears. Nearly every child over 1 year was infested with worms, and consequently were victims of cough, fever, anemia, and general debility. The number of infants being artificially fed was astonishing. So here they're referring to formula milk or sweetened condensed milk. They were found tightly bound up in layers of heavy clothing and kept in dark, airless cubicles, often for the first few months of their lives. Many of these children suffered from rickets, a disease I had been told did not exist in Malaya because of the abundant sunshine. These cubicles were often so dark I had to use my torch to see the mother and baby, the air so humid that my glasses became blurred. I once found a poor little rickety baby sucking his milk from a large black bottle with a tube half a yard long connected to a thin hollow bamboo cane thrust through the hole of an empty cotton reel which formed the stopper. I gave the mother a hygienic feeder with a short teat and successfully fed the baby. For safety, I was proposing to take the tube outfit away. This caused a great upset. The mother said, "Oh, yes, that is all right for the baby, but what would the pig do?" Disclosing a little sucking pig under a rattan cover which was being fattened for the Chinese New Year, baby and pig sharing one feeder. Okay, so this part was quite incredible. Like when I read this, I was firstly trying to imagine like this situation, like what is going on here. So it looks like okay, there's a baby on the bed, and then underneath there's a pig, and both baby and pig have like a long tube, and it's connected to one container of milk. Anyway, moving on. One of the most important achievements has been the persuading of Chinese grandmothers that sunshine, fresh air, and a daily bath will not harm the youngest infant. Also, that the 5 or 6 thickly padded coats necessary at some seasons of the year in China are never needed in Malaya. In 1927, the kampong folk made no use of the facilities provided for the sick in Singapore. If they knew of the maternity and general hospitals, they were too afraid to get to them. Okay, so then there's something about traveling dispensary, which is like a traveling clinic that carries some medicines. The Moto dispensary carried a doctor as well as an experienced dresser who spoke English, Malay, Chinese, and Tamil. In the first year, in addition to visiting all the newborn babies, house-to-house visits were made taking the same route as the travelling dispensary, which waited at agreed places on the roadside while I went into the kampongs. Any man, woman, or child found in need of treatment was given a card and sent out to the travelling dispensary. If anyone was too ill to go, a parent or friend would be sent with a card requesting the doctor to visit the home. It is the newborn baby, however, which has been the key to open the door of every home. House-to-house visits became unnecessary. People knew which day to expect us. Fathers waited at police stations to guide us to see their newly born infants. Groups of mothers and children waited at intervals along the roadside for sisters' weekly inspection. At this time, practically no rural mother received any skilled care in her confinement, so it was essential to give some nursing care to mother and babies at the first visit. It was this practical help which was so effective in gaining the confidence of the mothers and grandmothers. The last the most important member in the household. So here she says that she did not receive any skilled care because the indigenous bidan was seen as unskilled. I mean, they were considered unskilled by the colonial administration. Useful as these wayside clinics were, more effective educational work could be done at the center where the mothers could meet one another, compare the babies, and have a gossip. The welfare centers. The first held once a week in the small waiting rooms of two government outdoor dispensaries. At first, there was a meager attendance of children only. Now, after less than 2 years, there are 14 villages where welfare clinics are held 24 sessions a week and all thronged from 7 a.m. for 6 or 7 hours without ceasing. Some of the welfare centers are converted shop houses with a resident health nurse and a midwife. Branch centers have a resident midwife only. In addition, sessions are held in unoccupied PWD coolie lines, in a Malay clubhouse, on the verandas of rural police stations. Our most commodious center was built at the 18.5-mile Lim Chu Kang by Teo Neo, a Tauke who wished to have the health nurses services for all the squatters in that district. The health nurse visits the homes in her district, assists at the clinic, and oversees the work of the midwife. The midwife is on call to attend any poor mother in her confinement and attends for a week afterwards. At the last two visits, the mother must bathe the baby herself under the supervision of the midwife. So actually, I'm kind of confused. Like they say it's a kampong, but then they are also squatters. So I'm not sure what is the living situation in this case. The babies attend the nearest welfare center from 1 month old and live in good health come monthly for weighing and inspection, and for the mothers to receive advice on their nutrition and nurture. If they are not thriving, they attend weekly. In old days, parents were afraid to remove the baby's clothes. They all came unbathed, and the weighing scales were regarded with horror. That is all changed. The babies and mothers arrive bathed, often in holiday attire. Every child is stripped and weighed. Some mothers are attending with the seventh baby in succession. The purposes of the work are primarily educational and preventive. Treatment of minor ailments and first aid are incidental. Parents have learned to regard the welfare centers as health centers, where they come for help and advice to keep healthy children healthy, and not, as at first, dispensaries for sick children. The centers act as advisors for all needing medical treatment and get them to attend the appropriate hospital or dispensary with whom we have good cooperation. At the welfare centers, all elaborate equipment is avoided. We aim at efficiency with economy. Demonstrations are given as far as possible with articles which mothers can use in their own homes. All the homes are visited, so the economic conditions are known and how far it is possible to attain our standards of hygiene. Diets the mothers cannot afford are never advised, but they are encouraged to make the best use of the resources of their own kampongs. What had been achieved in 10 years? The infant mortality rate has reduced for the rural areas from 263 in 1927 to 117 in 1937 and 83.36 per thousand in 1938. So remember that it was about 260 something per 1,000, and then for the Malays it was 300 per 1,000. So now it's down to less than 1%. Is that right? Less than 1% or less than 10%? Okay, there are now 14 villages where welfare clinics are held. Free midwifery service is provided for all poor mothers, and private midwives are registered and supervised. So here, the private midwives, they are referring to probably the bidan, some bidan who had already been through courses and they have already taken practical or oral exams. This article came from, it's called The History of Obstetrics and Gynecology in Singapore. It was edited by two obstetricians, and it's like a celebratory publication. I'll probably make a couple more videos about this book, but I think what it shows us is kind of what does the field, like the reason I'm interested in this book is because it's what the field of obstetrics, uh, how does it describe itself, and what is the story that it tells about its own birth and its own development over the decades. So here it has included this talk by Ida Simmons, and it has been given a different title. So the title here, it's given as the pioneering work of maternity and child health services. So you can see in this book, they've arranged the story of maternity care from a primitive past where we had unskilled bidan, and then when Ida Simmons comes as a public health matron, then she's doing a pioneering work, helping to teach the local people on how to take care of their babies, on how to maintain hygiene. And then, as we'll see later in this book, at the end of the book, you'll see how technology has progressed and helped women and babies in Singapore. All right, that's it, guys. See you in the next video.